Suffering with a bunion and think surgery is your only option? Hey everyone, this is Dr. Scott Gray from Back in Motion, Sport and Spine Physical Therapy and Specialty Trained Physical Therapist. So in this quick video, I'm going to explain to you, what the one thing you want to look for when to discern do you need surgery for your bunion or if it can be corrected naturally. So in these next couple of videos, I'm going to show you first off, do you need it? But then also I'm going to show you how to fix it, or one of the most common mistakes that we see amongst patients who develop bunion deformities. We want to look at what a bunion is. So if you can see here, a bunion really is a first-rate deformity where we get the TMT joint here, which is our tarsal, is going to kind of deviate medially, but then this phalanx here is going to deviate back out laterally. So usually you'll see a bunion deformity here on the outside, or an exotosis here that gets kind of red and worn out. And so it's commonly what you'll see is that patients who need a potential bunion surgery is that they are unable to move their toe outward. So in this case of this patient, see how I can move her foot and her big toe outward? So that tells me that this isn't an osseous structural component at this time, and that we can modify and change that. So now in the next video, we're going to go over some common things that causes a bunion. And believe it or not, it usually doesn't start here in this part of the foot. It's usually in the back part of what they call the rear foot. So let's take a look at that. All right, so the first thing we want to do when we're looking at someone who has a potential bunion is we want to look at just the posture of the overall foot. So typically, and generally speaking, most patients who develop a bunion have what they call a pes planus, or flat arched foot. And that's because it changes the mechanics of that first ray where the bunion occurs. But usually with a flat foot occurs, it's usually a rear foot dysfunction. And so what we'll commonly see is the foot is everted or pronated at the rear foot, which then causes the front part of the foot to kind of splay out, which then changes the biomechanics of the first toe. So another common thing that causes bunions or forefoot abnormalities is something actually up at the hip joint. So there's a thing called femoral anteversion, which causes the hips to kind of go in this knock knee position, which can cause the foot then to collapse and pronate. So we're just kind of look at that in this patient. The other side of it is just weakness of the hips. So when the hip muscles are weak, you can also cave in at the knees, which then makes the foot flatten out. So it really, to attack and treat a bunion, you need to look at the foot, you need to look at the bunion itself, but then you also need to work your way up at the hip joints because it's really important. So a couple quick tests that you can do is just to take the patient's hip and rotate it internally and then externally. And if you find that you've got an excessive amount of rotation at the hip joint into internal rotation, but not a lot into external, you might be thinking that this patient potentially has anteversion. And then, so I'll do the other side here. And I don't necessarily feel that per se. I think it's more of a weakness at her hips. So we'll look at that here in the next video and kind of show you some tests that we look for to look at the strength of the hip muscles. All right, so in this next video, we want to take a look at the functional strength of the hips and see what that does. So I've got my patient here, so let's just go ahead and stand on your right foot for me. And a few things we want to look at, and you can already kind of see from my angle here, is her femurs are already kind of rotating inwards, which is going to pronate the foot, and it's going to limit the ability of the foot to do its normal mechanics. So then from here, I just have the patient reach straight out and back. And we'll have them do about 10 reps. The things that we're looking for is, can the knee track straight over the toe? If it can't, and it's diving down and in, that shows us that the hip is weak and that it's causing excessive pronation at the foot. So this is really important stuff in regards to treating someone who has a potential bunion, especially when they're early on in their age. So one of the things we want to do from a treatment standpoint is, as mentioned in the previous videos, is work on the rear foot or the subtalar joint. So that's the joint that causes excessive pronation. And if the foot can't resupinate, then that bunion in the forefoot will splay out. So in this case, I got my patient here, and we're just going to swing her right foot around the corner as I then kind of mobilize her back foot joint. So go ahead and do that. And basically what I'm trying to do is just get her arch to kind of open up a little bit as it would when she walks. So you can see here how her arch is raising up, her foot is raising up, as I kind of rotate her tibia, and then I also kind of rotate her heel. So it shows me that she can. These are things that we can potentially work on. There'll be some calf strengthening as well, but also just some functional mobilization of the rear foot to get to resupinate. So another simple exercise that you want to do is just a simple calf raise. And this is really good for two reasons. A, it's going to strengthen all the calf muscles that kind of help supinate the rear foot, but it also is going to help her put weight through her big toe the correct way instead of letting it splay out. So what we kind of like to do is just kind of, you Crystal, just go ahead and go up on your toes for me, as high as you can, do a calf raise. You're going to go up on your toes and lift up, yep, perfect, and then back down. And so as you can see here, when she does that, her heel supinates or inverts, so that's a good sign that we can fix her. That's not typically like a structural thing in her foot. And so she's also getting some good motion and going through her toe, which is kind of self-correcting itself and it's not splayed out. So these are all really good signs. So another common thing that causes a bunion that sometimes needs to be addressed is at the TMT joint. And so that's this joint kind of right here. So it's just proximal to the big toe joint. And so this is important because what happens is sometimes this joint here will become hypermobile and it will move too much. So then it causes this joint adjacent to it, which is the MTP joint, to splay out. So then you can get bunions. So these are things you always want to kind of look at and check for. So typically what we would do is, if it's hypermobile, we would try to strengthen some of the foot intrinsics. But this patient would potentially need a pad underneath the bottom of her foot here to stabilize this joint so that when you step, it doesn't move and glide all these different ways. So those are just some things to consider, you know, if the conventional stuff isn't working. Likewise, you also want to have a patient, like you see online, these spacer things going on. And so these spacers go in between the feet, which is really good to kind of help prevent the bunion from, or the first toe, from drifting in. So putting that spacer, that really kind of does help the foot. And then from there, what we want to do is really ultimately strengthen. There's a muscle here called the abductor hallucis that runs across the inside medial part of the foot, and it starts all the way here at the calcaneus and comes across. And we want to kind of retrain this muscle, because what happens is when you get a bunion, the line of pull changes, and then you lose function of that muscle. So there's different ways that we can, from a neuromuscular re-education or taping and that, to kind of get that muscle to fire again, to help kind of pull, if you look here in this toe, to pull this toe back outward to help her fix and correct her potential bunion deformity.